Welcome to week 10, you guys. Can you believe it? Okay, so we're going to combine chapters 8 and 9 this week. Um, Ultimately, our intended purpose is to become more aware of the impacts of drugs and alcohol, the use, misuse, and abuse. So this is going to be a little bit lengthy, but I think it's super interesting, and we're going to have some good class collaboration as a result. Addiction is the continued involvement with a substance or activity despite ongoing consequences. It is classified as a mental disorder by the American Psychiatric Association. The addictive behavior initially provides a sense of pleasure or stability beyond the addict's power to achieve in other ways. To be addictive, a substance or behavior must have the potential to produce positive mood changes such as euphoria, anxiety reduction, or pain reduction. People with psychological dependence on a substance experience tolerance when they need more of the substance to achieve the same effect. They also experience withdrawal, a series of temporary physical or psychological symptoms that occur when substance abuse stops. Psychological and physiological dependence are so intertwined that it is not really possible to separate the two. Addictions are characterized by 5 common characteristics. Compulsion, which is characterized by obsession with or excessive preoccupation with or the behavior and an overwhelming need to perform it. Loss of control or the inability to predict reliably whether an isolated occurrence of the behavior will be healthy or damaging. Negative consequences such as physical damage, legal trouble, financial trouble, which do not occur with healthy involvement in any behavior. Denial, the inability to perceive that the behavior is self-destructive. They just can't even see that what they're doing is not healthy for them. And the inability to abstain, continuing to use regardless of negative outcomes. Addiction is a process that develops and evolves over time, and the pattern is known as nurturing through avoidance. It's maladaptive. It's a maladaptive way of taking care of emotional needs. Habits and addiction can look similar. Addiction involves elements of a habit. It's a repeated behavior in which the repetition becomes unconscious. A habit can be broken. An addiction involves repetition of a behavior that occurs with compulsion. It's I need, and its considerable discomfort occurs if the behavior is not performed. Family and friends often struggle with codependence, which is a self-defeating relationship pattern in which a person is controlled by the addict's addictive behavior. A codependent person finds it hard to set healthy boundaries, and they often live by the chaotic, crisis-oriented mode that naturally occurs around addicts. Family and friends can play an important role in getting an addict to seek treatment, but they can also play an important role in enabling, which is when people who unknowingly or knowingly protect addicts from the consequences of their behavior. Drug chemicals are not the only source of addiction. People can become addicted to certain behaviors, and these are called process addictions. They're called process addictions because they are mood altering. Things like gambling can be a process addiction, compulsive buying, compulsive exercise, gaming, work addiction, there's workaholics, and sexual addiction. Those are all process addictions, and I'm not going to go too deeply into them. If you have any questions, we can talk about them further. Drugs are substances other than food that are intended to affect the structure or function of the mind or body through chemical action. Scientists divide drugs into 6 categories. Prescription medication over the counter. Medications, those are legal substances like alcohol, caffeine, and tobacco. So there are different types of drugs. So prescription drugs, they're obtained only with a prescription from a licensed physician. OTC, over the counter, there's no prescription needed, and there are more than 100,000 available. Recreation most are legal substances such as alcohol, tobacco, and coffee, caffeine. Herbal preparations, products of plant origin, illicit or illegal drugs, those are all psychoactive. And commercial, those are found in commercially sold products such as household cleaners and pesticides. Pleasure, which scientists call reward, it's a powerful biological force for survival. And if the brain does something that feels pleasurable, the brain's wired to want to do it again. So this is sometimes even called chasing the high. One set of nerve cells that are devoted to producing and regulating pleasure sit at the very top of the brainstem and uses a chemical neurotransmitter called dopamine. All addictive drugs can activate the brain's pleasure circuit, known as the mesolimbic dopamine system. Drug addiction is a biological, pathological process that alters the way in which the pleasure center, as well as other parts of the brain, function. Psychoactive drugs change the way the brain works by affecting chemical neurotransmission, either enhancing it, suppressing it, or interfering with it. So you can actually be altering the neurotransmitters in your brain with drug use. Routes of administration refers to the way in which the drug is taken into the body. Oral ingestion is the most common. Inhalation has the most rapid effect. That's through the nose or mouth, inhaling it. Injection, that's actually the most dangerous, and that can be intravenous, IV, intramuscular, IM, into the muscle, or sub-Q, subcutaneous, just under the skin. Transdermal is through the skin, so it's often a patch, right? So some people have that nicotine patch, so they're getting the nicotine through their skin on a patch. And then there's also suppositories, and that is either vaginally or anally taken into the body. There are several drug interactions to take into consideration. Polydrug use is taking several substances simultaneously. This can frequently lead to dangerous health problems unless this is carefully monitored by a health professional. Synergism, which is also called potentiation. It is an interaction of two or more drugs in which the effects of the individual drugs become amplified. Both drugs become amplified and would normally be expected when taken alone. So it's kind of amping up the drugs, like think of it as 2 + 2 = 10. Inhibition, it's the effects of one drug are reduced or eliminated by the presence of another at the same receptor site. And antagonism refers to two drugs at the same receptor site so that one drug blocks the action of the other. Intolerance occurs when drugs combine in the body to produce extremely uncomfortable reactions. Cross-tolerance occurs when a person develops a physiological tolerance to one drug that also increases the body's tolerance to other substances that act similarly in the body. Abuse is often associated with illegal drugs, but many people abuse and misuse legal drugs. Drug misuse involves using a drug for a purpose for which it is not intended. Drug abuse is the excessive use of any drug. It may cause serious harm. Approximately 27 million people report being current users of illicit drugs. High doses of over-the-counter drugs can cause hallucinations, bizarre sleep patterns, mood changes, and sometimes death. It comes in the form of pills, liquids, nasal sprays, and topical creams. Several types of OTC drugs are subject to misuse and abuse, such as caffeine pills, energy drinks, cold medicines, diet pills, sleep aids. Sleep aids can cause problems with sleep cycles and weaken areas of the body or induce narcolepsy. Narcolepsy is when you fall asleep at any given moment. So I'll be in the middle of lecture and out cold. Caffeine in large doses can result in tremors, shaking, restlessness, edginess, insomnia, dehydration, panic attacks, heart irregularities, among other symptoms. Today, the abuse of prescription drugs in the United States is at an all-time high. And the latest data suggests that about 6.4 million Americans aged 12 and older used prescription drugs for non-medical reasons in the past month. It is particularly common among teens and adults, and it may be getting worse among the youngest segment of society, with nearly 13% of 12th graders reporting prescription drug abuse by the time they graduate. Risks vary greatly, from irregular heart rate to death, and injecting prescription drugs may result in exposure to HIV, hepatitis B and C, and other bloodborne viruses. The use of illicit prescription drugs is growing on college campuses, and the most commonly abused prescription drugs on college campuses are stimulants, drugs that are intended to treat ADHD. So Adderall and Ritalin. What Adderall and Ritalin do for somebody who has ADHD is their ADHD brain is going really, really fast, and the Adderall and Ritalin slow it down to focus. And for somebody who does not have ADHD, it speeds the brain up, so it has the opposite effect. But it can also speed up your heart rate and cause a tremendous physical stressors on the body. Most commonly reported side effects are sleeping difficulties, irritability, and reduced appetite with taking any of those. Illicit drug use does not discriminate, and it spans all age groups, genders, ethnicities, occupations, and socioeconomic groups. Marijuana use has risen in recent years. Close to 50% of college students nationwide have tried an illicit drug at some point, the vast majority of them reporting it being marijuana. Substance use among college students has many short and long-term negative consequences. College offices are concerned about the link between substance abuse and poor academic performance. So we can see the list here of why do some college students use drugs and why don't some college students use drugs. So take that into consideration for yourself. Why do you use or why do you not use? It has been shown that students who are engaged in academics, in groups, and college athletics have a reduced rate of drug use. We're going to start looking at some common drugs of abuse, stimulants. First up on the list is a drug that increases activity of the central nervous system. Its effects include increased activity, anxiety, and agitation. Cocaine being a stimulant, it is a white crystalline powder. It's a powerful stimulant made from leaves of the South American cocoa shrub, and it is one of the most powerful naturally occurring stimulants. Cocaine can be snorted, smoked, or injected. It is both anesthetic and a stimulant of the central nervous system. So it has medicinal purposes, and this is where a lot of our drugs are actually derived. So lidocaine. There is anesthetic. It's something that's used to numb the body. Cocaine, they're derived from the same space, from the same plant. In tiny doses, it can slow the heart rate. In larger doses, it can increase heart rate and blood pressure. It can reduce appetite and cause convulsions, muscle twitching, irregular heartbeat, and even death resulting from overdose. You may even see people who snort anything, any inhalant actually, can cause the capillaries in the blood in the nose to break and cause nosebleeds. Amphetamines include a large and varied group of synthetic agents that stimulate the central nervous system. Some are used for medicinal purposes. Small doses improve alertness, lessen fatigue, and elevate mood. Physical and psychological dependence develops with repeated use, and high doses over long periods can produce hallucinations, delusions, and disorganized behavior. Certain types of amphetamines are used for medicinal purposes, like the Ritalin and Adderall. Methamphetamine is an increasingly common form of amphetamine. It's potent, it's long-acting, it's inexpensive, and it's highly addictive. Meth can be snorted, smoked, injected, or orally ingested, and the effects depend on the method of use. Snorting and oral ingestion have shorter effects, while smoking meth can produce a high lasting over 8 hours. Problems resulting from long-term use include risk of Parkinson's disease, severe weight loss, cardiovascular damage, increased risk of heart attack and stroke, hallucinations, extensive tooth decay and tooth loss, violence, paranoia, psychotic behavior, structural and functional changes in the brain, increased risk for sexually transmitted diseases. Bath salts are synthetic cathinones. They're drugs that are chemically related to the stimulant cathinone, which occurs naturally in the khat plant. This drug can have significant negative cardiovascular effects: rapid heart rate, increased blood pressure, chest pain. Psychiatric effects such as anxiety, agitation, hallucinations, paranoia, erratic behavior. Increased risk for depression and suicide are also associated with bath salts. Symptoms include tremor, shortness of breath, loss of appetite, with bleeding from the nose and throat, and due to ulcerations when snorted. Caffeine is a legal stimulant, but excessive consumption is associated with addiction and certain health problems. It is found in coffee, tea, and chocolate. It can enhance mental alertness and reduce feelings of fatigue. Side effects include wakefulness, insomnia, irregular heartbeat, dizziness, nausea, indigestion, mild delirium, we get a little delirious, and heartburn. Caffeine meets the requirements for addiction due to tolerance, psychological dependence, and withdrawal symptoms. Here's a quick depiction of caffeine content consumption. Your gourmet coffees from Starbucks has significantly higher levels of milligrams of caffeine than, say, a black tea. So be mindful of where you are getting your caffeine intake. Today, marijuana is the most commonly used illicit drug in the United States. Marijuana is derived from Cannabis sativa or Cannabis indica hemp plant. And the psychoactive substance in marijuana is tetrahydrocannabinol, otherwise known as THC. And it's much easier to say. It does have many medical purposes, as it controls nausea and vomiting and improves appetite. It reduces muscle pain and spasticity caused by multiple sclerosis. So there are also noticeable effects, side effects. It's the dilation of the eyes. Users also experience coughing, dry mouth and throat, impaired body movement, increased heart rate, and changes in mood. Hashish is derived from the plant resin and contains high concentrations of THC. Marijuana substantially reduces a driver's ability to react and make quick decisions. Marijuana slows us down, and so we are not as reactive as we need to be when operating heavy machinery. Combining marijuana and alcohol enhances the impairing effects of both drugs. Lung conditions such as chronic bronchitis, emphysema, and other lung disorders are associated with smoking marijuana. Frequent or long-term marijuana use may significantly increase a man's risk of developing testicular cancer. The link between marijuana and common mental health disorders is conflicting, but use is associated with a higher likelihood of drug dependence. Synthetic marijuana, aka K2 or spice, It's a diverse family of herbal blends. It's marketed under many names, containing dried, shredded plant material and one or more synthetic cannabinoids, which result with results that mimic marijuana, but with longer duration and poorer detection in urine drug screens. So it causes a range of health effects such as hallucinations, severe agitation, extremely elevated heart rate and blood pressure, coma, suicide attempts, and drug dependence. And you really just don't know what you're getting because synthetic, there's so many other additives in there as well. Depressants slow down neuromuscular activity and cause sleepiness or calmness. If the dosage is high enough, brain function can slow to the point of causing death. Alcohol is the most widely used central nervous system depressant. Benzodiazepines and barbiturates are sedative drugs that promote mental calmness and reduce anxiety. Hypnotic drugs, they promote sleep or drowsiness. Common are Valium, Ativan, and Xanax for benzos. Barbiturates, those are also sedative and hypnotic drugs, such as Amytal and Seconal. They're less safe than benzodiazepines and have been mostly replaced by benzos when prescribed. Synergistic effects happen when combined with alcohol and can lead to respiratory failure and death. They can produce physical and psychological dependence within several weeks. And cross-tolerance is a complication specific to sedatives. Rohypnol, otherwise known as a date rape drug, produces a sedative effect, amnesia, muscle relaxation, and a slowed psychomotor response. It is often used in sexual assault, as is gamma hydroxybutyrate, GHB. It is a central nervous system depressant known to have euphoric or sedative and anabolic bodybuilding effects. There are some bodybuilders that use GHB, but it is also used as a date rape drug as well. Side effects include loss of memory, unconsciousness, amnesia, hallucinations, and death. Alcohol has been used throughout history for everything from social gatherings to religious ceremonies. Very low levels of alcohol, particularly red wine, may lower some risks, health risks in older adults. Alcohol is a drug and when not used responsibly can be very dangerous. More than half of all Americans consume alcoholic beverages regularly, and about 21% abstain. Men typically drink more regularly and drink more than women. The intoxicating substance in beer, wine, and liquor is ethyl alcohol or ethanol. It's produced through a process called fermentation. Hard liquors go through another process called distillation, and proof is the measure of the percentage of alcohol. So 80 proof whiskey is the equivalent of 40% alcohol. So a standard drink is any drink that contains about 14 grams of pure alcohol. And so we can look at the equivalents here. So a standard drink, so a standard beer, 12-ounce beer, which is 5% alcohol, a 12-ounce is equivalent to a 7% malt liquor at 8.5 ounces. So that's how much you're drinking of it. Is equivalent to 12% table wine, 5 ounces. So a 5-ounce glass of wine equals a 12-ounce beer. And an 80 proof spirits, so gin or vodka, 1.5 ounces. So one 12-ounce beer, one 5-ounce glass of wine, 1.5 ounces of alcohol are equivalent. But it's not those crafty beers, like those suckers are up there, and some of them are like 17% alcohol. So you need to be mindful of what the percentage of alcohol or what the proof is of what you're drinking. Alcohol molecules are sufficiently small and fat soluble, and they're absorbed throughout the entire gastrointestinal system. How quickly your body absorbs alcohol is influenced by several factors. The alcohol concentration of the drink, the amount of alcohol you consume, the amount of food in your stomach, your metabolism, weight and body mass index, your mood. The higher the alcohol concentration in your drink, the more rapidly it will be absorbed in your digestive tract. Carbonated beverages and drinks with mixers are absorbed more rapidly. These drinks cause the pyloric valve to relax, thereby emptying the stomach contents more rapidly into the small intestine. The more alcohol that you consume, the longer the absorption takes. The breakdown of alcohol in the body occurs at a fairly constant rate of 0.05 ounce per hour. So this is slightly less than one standard drink per hour. So if you're hanging out with friends and you drink 5 drinks over 2 hours, at that 2-hour mark, your blood alcohol level is going to be increasing for another hour. At the end of that hour, at a rate of about 1 drink per hour, you're going to start becoming sober. It's not how much water you drink because it's already in your blood, which comes to your blood alcohol concentration with the ratio of alcohol to blood volume. The legal limit in any state is 0.08%. So if you were to get pulled over and you did the breathalyzer and blew a 0.09, you're going to jail. But guess what? If you blow a 0.04, you also have the chance of going to jail because that's suggested. So that's the legal limit. But if the officer decides, because he doesn't know at what rate you are, did you stop drinking 3 hours ago? Did you stop drinking an hour ago? They can also arrest you. Both breath analysis, the breathalyzer, and urinalysis are used to determine whether an individual is legally intoxicated. Blood tests are more accurate, but and they're required in many states, but you're not going to have a blood test done in the street if you're pulled over. Learned behavioral tolerance, even though the BAC might be quite high, the individual has learned to modify his behavior to appear sober. So when you have those the street tests, right, the field sobriety, people can learn how to do that and function under alcohol because of that learned behavioral tolerance. So I hear quite often that I had 15 beers and it didn't affect me. It's just not possible, because you can look here at the blood alcohol concentration, not impaired, right? At 0.01, there's negligible, like it may or may not, right? 0.01 to 0.04, there's some slight muscle relaxation, mild euphoria, slight body warmth, increased sociability, talkativeness. Anybody who holds a CDL, 0.04 is their limit. It's cut in half from anybody who, a regular driver's license. You're usually impaired at 0.05 to 0.07. You've got a lowered alertness, impaired judgment, lowered inhibitions, exaggerated behaviors. And then you are impaired if you have a 0.08 and upwards. So it goes from slowed reaction time, and we'll demonstrate some blurred vision as we go up, impaired consciousness, disorientation, loss of motor function. And 0.35 and up, there's typically unconsciousness, coma, extremely low heartbeat and respiration, and it could result in death. So the more you drink, the higher these levels are going up because it goes into your blood. It's not how much water you're drinking. I've also had people tell me, well, I'm drinking a glass of water and I'm peeing it out. Well, that's awesome because it's not in your urine, it's in your blood. So your blood alcohol content depends on your weight in body fat, the water content in body tissues, right? So it is. So if you are drinking more water and your organs are have more water, it will help to metabolize the alcohol faster, but it's still getting into your blood. The concentration of alcohol in the beverage consumed, like we talked about, alcohol concentration is higher in people with more body fat Women generally have more body fat than men. And women have half as much alcohol dehydrogenase as men. So we don't metabolize it as well as men do. Alcohol depresses the central nervous system functions. Vital functions become noticeably affected, and in extreme cases, coma and death can result. Alcohol is a diuretic, but water is pulled out of the cerebrospinal fluid, resulting in morning after headaches. Hangover. Alcohol is involved in approximately 70% of fatal injuries during activities such as boating and swimming. And heavy drinking is associated with dating violence. Alcohol use by women makes them more vulnerable to sexual assault. Alcohol is one of, if not the only, drug that affects every single organ in the body, from your nervous system, senses, skin, heart disease, or heart and lungs, stomach, urinary system, sexual responses, reproductive system. Causes birth defects if a woman drinks while she's pregnant. Fetal alcohol syndrome is one of the notable birth defects associated with alcohol. You end up with an increased risk of osteoporosis. Your immune system lowers, and you're at increased risk of diseases. And there's also memory impairment, and it can damage and destroy brain cells. Korsakoff's disease is one of the long-term effects of alcoholism. Acute alcohol intoxication, alcohol poisoning, can be fatal. The amount of alcohol that causes unconsciousness is dangerously close to a fatal dose. So the blood alcohol level continues to rise even after a drinker is unconscious. So it is, as after we stop drinking, our blood alcohol level is still increasing. Signs includes an inability to be aroused, weak, rapid pulse, cool, pale, or bluish skin, and it's important to call 911 immediately. Surveys indicate that over 20% of college students have driven after drinking. Alcohol-impaired drivers are involved in about 1 in 3 crash deaths and nearly 10,000 deaths annually. This represents one alcohol-related fatality every 53 minutes. The likelihood of a driver being involved in a fatal crash rises significantly with a BAC of 0.05 and even more so after 0.08. When somebody is involved in DUI, it's typically they've already driven, I think the statistic is 300 times under the influence. And so it's not as, there's more people out there that are driving under the influence than we like to really think about. There are long-term effects associated with drinking alcohol. There are effects on the nervous system. People who drink even moderately experience shrinkage in brain size and weight and loss of some degree of intellectual ability. Developing brains in adolescents are much more prone to damage than previously thought. Alcohol and weight gain. By drinking an extra 150 calories a day, you gain 1 pound a month and up to 12 pounds a year. There are cardiovascular effects. Drinking too much alcohol contributes to high blood pressure and increasing the risk of stroke and heart attack in some people. Liver disease. One result of heavy drinking is that the liver begins to store fat, a condition known as fatty liver. It can also cause further damage, such as fibrosis. Alcoholic hepatitis is a serious condition resulting from prolonged use of alcohol. Alcohol is considered a carcinogen. It is cancer-causing. Prolonged use of alcohol has been linked to cancer of the esophagus, colon, rectum, breast, stomach, oral cavity, and liver. Other effects include chronic inflammation of the pancreas, blocked absorption of calcium, and reduced ability to fight of the body to fight bacteria and viruses. We kind of need all the help we can right now, right? So another problem from alcohol consumption is liver cirrhosis. And so here is a picture of A, a normal liver, and B, a liver with cirrhosis after chronic alcohol use. Alcohol is the most popular drug used on college campuses, and approximately 64% of students report having consumed an alcoholic beverage in the last 30 days. Approximately 38% of all college students engaged in binge drinking, which is drinking. For men, it's 5 or more drinks in about 2 hours, and for women, is consuming 4 or more in that time frame. And a significant number of college students experience negative consequences because of their alcohol consumption. Many students report practicing preventive behaviors to reduce the risk of negative consequences associated with alcohol consumption. It disrupts sleep, decreases alertness, and it may affect academic performances. A recent study reports that 1,825 college students die each year because of alcohol-related unintentional injuries, including car accidents. College students are at particularly high risk for alcohol-related problems for several reasons. Alcohol exacerbates their already high risk for suicide, automobile crashes, and falls. Many college and university students' customs and celebrations encourage certain dangerous practices and patterns of alcohol use. Alcohol advertising and promotions from the alcohol beverage industry heavily target university campuses. Beer and other drink specials enable students to consume large amounts of alcohol cheaply. I remember when I was away at college, there was a nickel beer night. Like, what? College students are vulnerable to peer influence, and administrators often deny that a problem exists. So they kind of turn their head to a lot of it. Alcohol use becomes alcohol abuse when it interferes with work, school, or social and family relationships, or when it entails law violations, including a DUI. Alcoholism or alcohol dependence occurs when alcohol use is so severe that stopping alcohol results in withdrawal symptoms. Identifying an alcoholic: there is craving, loss of control, tolerance, psychological dependence, and withdrawal symptoms. Those all must be present to qualify a drinker as an addict. And about 15% of people in the United States are problem drinkers. One study shows that 20% of college students meet the criteria for alcohol abuse or dependence in the past year. And so what I will tell you is, if you have ever experienced the headache after drinking, that's a withdrawal symptom, and that's a detox. Your body is detoxing the alcohol from your system, and you are experiencing withdrawal symptoms. So there's both biological and family factors, as well as social and cultural factors that attribute to alcoholism and alcohol abuse. So higher rates of alcoholism occur among children of alcoholics, and scientists have not identified an alcoholism gene. So the link is more of a, it's not genetic, but it is passed down through the family. Family attitudes play a role, because people raised in cultures in which alcohol is part of a religious or ceremonial activities, they're less prone to dependence than people raised where purchase is controlled and alcohol use is regarded as a rite of passage. So there are other countries that alcohol use at a young age is normal, and so the abuse doesn't happen because it's not like taboo. It's just kind of part of the culture. So alcohol and prescription drug use, they exacerbate one another, and when taken together, they can cause alcohol poisoning, unconsciousness, respiratory depression, and death. Opioid stimulants, sedatives, and sleeping aids are most often combined with alcohol, and that synergistic effect happens. Estimated alcohol-related costs to society are well over $249 billion when health insurance, criminal justice costs, treatment costs, and lost productivity are factored in. Alcoholism is directly or indirectly responsible for more than 25% of the nation's medical expenses and lost earnings. Alcoholics who decide to quit will experience detoxification and may experience the following withdrawal symptoms: hyperexcitability, confusion, agitation, sleep disorders, convulsions, hand tremors, depression, headaches, seizure, and possible DTs, delirium tremors. Treatment programs include private facilities and therapy. Relapse is often considered a part of the recovery program process, and treatment requires more than just stopping drinking. There must be a guard against relapse. So situations that could result in relapse, such as becoming angry, frustrated, being around drinkers, being pressured to drink, must be identified, right? What are the triggers? Joining a support group is really beneficial, AA, maintaining stability by avoiding major life changes. And effective recovery programs help addicts create self-esteem and resume personal growth. So we're going to shift into narcotics, and opioids cause drowsiness, relieve pain, and induce euphoria. They're called narcotics. They're derived from opium. They include morphine, codeine, heroin, and black tar heroin. They depress the central nervous system and lower heart rate, respiration, and blood pressure. They also decrease sex drive. There has been an increasing amount of deaths due to heroin overdose as the drug becomes increasingly common in suburban and rural communities, with deaths skyrocketing from 18,000 deaths in 2000 to nearly 12,990 in 2015. Heroin is a white powder derived from morphine, often used in hospitals to reduce pain. Black tar heroin is a sticky, dark brown, foul-smelling form of heroin that is relatively pure and inexpensive. Heroin withdrawal is distinct, including an intense desire for the drug, sleep disturbances, dilated pupils, and muscle tremors. Mainlining causes veins to scar and eventually collapse. Hallucinogens or psychedelics are substances capable of creating auditory or visual changes in mood, thoughts, and feelings. The mixing of sensory and messages that causes hallucinations is known as synesthesia. Users may also become less inhibited or recall events long buried in the subconscious mind. People say that they hear colors or smell tastes. LSD, known as acid, is one of the most potent hallucinogenic drugs and comes on small squares of blotter-like paper and thin squares of gelatin or in tablets. The psychological effects include dysphoria, euphoria, distorted perception, and auditory and visual hallucinations. Ecstasy is one of the most well-known club drugs. It creates a feeling of extreme euphoria, openness and warmth, and increased willingness to communicate feelings of love and empathy, increased awareness, and heightened appreciation for music. The risks include inappropriate emotional bonding, jaw clenching, tongue-in-cheek chewing, short-term memory loss, or confusion. And chronic use of these hallucinogens can cause damage to the brain. Combined with alcohol, ecstasy can be fatal. So PCP was originally developed as a dissociative anesthetic. The effects depend on dose and include slurred speech, impaired coordination, fever, nausea, and total loss of sensitivity to pain. Doses greater than 10 milligrams can cause convulsions and death. Psychologically, PCP may produce either euphoria or dysphoria. Mescaline comes from the peyote cactus and is both a powerful hallucinogen and a central nervous system stimulant. Users swallow buttons or soak them in liquid to create an intoxicating liquid, and it generally induces immediate vomiting for the user. And so side effects include vomiting, dizziness, diarrhea, and headache. Sounds like a great time. Psilocybin or psilocin, it's a mushroom, also known as magic mushrooms. Similar effects to LSD, generally wears off in about 4 to 6 hours. But mushroom varieties can be really misidentified and mistakes can be fatal. Ketamine is the liquid form of ketamine, special K, is used in anesthetic in some hospitals and veterinary clinics. And for illicit use, it's stolen. For illegal use, from hospitals and medical suppliers, and it's dried and distributed in a powder form. It causes hallucinations by inhibiting the relay of sensory input. And the effects of ketamine are similar to PCP, but even less predictable. So when I would use ketamine working in a laboratory on monkeys, it would cause them to have like an anesthetic effect, so we could perform procedures. And in dogs, it would often induce a heart attack. Inhalants are vapor-producing chemicals that, when inhaled, can cause hallucinations and create intoxicating and euphoric effects. Because they are inhaled, the volatile chemicals in these products reach the bloodstream within seconds, but the effects do not last long. An overdose of fumes from inhalants can cause unconsciousness or even death. So things like glue, paint thinner, rubber cement, anytime like huffing, amyl nitrate and nitrate and nitrous oxide are also abused. Users experience dizziness, disorientation, impaired coordination, and judgment. Combined with alcohol, it may be fatal. Anabolic steroids are artificial forms of the male hormone testosterone that promote muscle growth and strength. They produce a state of euphoria, diminished fatigue, and increased bulk and power in both sexes. Adverse side effects include mood swings, roid rage, acne, liver tumors, elevated cholesterol, hypertension, and kidney disease. In women, large doses trigger development of male attributes. In men, anabolic steroids shut down testosterone production, their own testosterone production, causing men's breasts to grow and testicles to atrophy. An estimated 20.8 million Americans aged 12 or older needed treatment for an illegal drug use or alcohol use problem in 2015. And of these, only approximately 10% received that treatment. Detox is an early abstinence period when the addict physically and cognitively adjusts to being free from the addiction's influence. Outpatient behavior treatment consists of CBT, cognitive behavior therapy. It's how our thoughts and behaviors affect one another. Multidimensional family therapy. Motivational interviewing, exploring the motivation behind behaviors. And motivational incentives, contingency management. Residential treatment programs, therapeutic communities are highly structured programs in which addicts remain at the residence, typically for about 6 to 12 months. And then there's also 12-step programs. Those are non-judgmental treatment programs that aim to work on personal recovery. Again, AA being one of the 12-step programs. There are currently vaccines in development against addictive drugs, but that does not eliminate the desire for the drug. It prevents the user from getting high by stimulating the immune system to attack the drug when it is taken. So they're not yet available, but they are in production. Other pharmacological treatments available, these are also called harm reduction. Methadone is available for people addicted to heroin or other opioids. It's used to control withdrawal symptoms. People on methadone still get high, but it's not causing as many adverse effects as the heroin or opioid does. Naltrexone eliminates the compulsion to use opioids. Buprenorphine has the same effect as methadone, and it can be taken at home. Methadone, you typically have to go to a clinic. Some clinics do let you take home methadone as well, though. Early intervention is really, it increases the likelihood of successful treatment. Private therapy, group therapy, cognitive training, nutrition counseling, and health therapies will all help with recovery. A growing number of colleges are offering special services to students who are recovering from alcohol and other drug addictions and want to stay in school without being exposed to excessive drinking or drug use. Illegal drug use in the U.S. costs about $193 billion per year and $11 billion in the cost of healthcare. 120 billion in lost productivity and 61 billion in costs to criminal justice systems. There are no simple solutions to this complex problem. We're not even going to talk to the familial complications that drug and alcohol use has. It really is systemically impacting all areas of our communities. Drug abuse has been a part of human behavior for thousands of years and is likely not going to disappear in the very near future. And most people agree that to combat the challenge, we need a multimodal approach, and young people must be educated to understand how drug use, misuse, and abuse differ. There are harm reduction strategies, needle exchange programs, changing legal sanctions and increasing treatment services, minimizing potential hazards with drug use rather than the use itself. We're not treating the problem, and the majority of the time we're throwing people in jail and incarcerating them. And what is that really doing to our addiction problem? So I hope you were able to take all of this in, bring your questions, comments, concerns to class, and let's collaborate. Take care of you.